It's me. My name is Ahmed Nasr. I'm here about 17 years experience, 18 years experience in dermatology, about 5 years in Egypt and 13 years in Saudi Arabia. My work here I changed 5 hospitals here in this country. Master degree 2010, European board 2014. Okay, number one, we have to know that atopic dermatitis has no curable medicine. It will come back. It's atopy. So all my rule is to separate the acute phase. So make the acute phase far away from the other phase. Okay. Number one, I must give the instructions of not to keep or to dry the water immediately after he take a shower or wash his hands or her hands. Number two, to use emollients all the time. Number three, his cloth must be cotton. Number four, to or avoid the predisposing factors, if like pollens, like food, like perfumes, which increase it. There is special washing soap or special washing liquid he must use, which not irritate the skin more and more. This is the instruction first. After that, I start the treatment. The treatment, if mild, I had to give only antihistaminic, a mild antihistaminic with a cortisone or a mild hydrocortisone, 0.1 hydrocortisone, like that. Or I can use the antihistaminic with creams not containing hydrocortisone, like emollients, like pipentine, like. Number three, if no response, I had to raise the level or to put like bimacrolimus creams. Okay, especially if he is young, not less than 6 years. If it increase, I must increase. I had to increase the medicine, like using other creams. I didn't prescribe systemic hydrocortisone except in a few patients. If there is secondary infection in the moderate atopic dermatitis, I start to treat it first before treating the atopy itself. Unfortunately, it's the cortisone, the best medicine which should give a result for atopic dermatitis. If it's recent, the patient or the child who comes with atopic dermatitis and tried many treatments before, the cortisone didn't give him or doesn't give him a response. But if it's the first or second or third or fourth or fifth time to experience the atopic dermatitis or come to a doctor or visit a doctor to treat the atopic dermatitis, the best of the creams is cortisone. But if he used many times, because there is something of tachyphylaxis on the skin when he used sorry, I mentioned some medicine like Dermovit or Elixir. When he used these medicines too much, the skin has a habit not to respond more. So I had to change it or to use something more potent. When the patient come to me and after I give him the instructions, I told him that your new friend or your new brother is the emollient. I mentioned it by words. Your new brother or new friend is the emollients in your car, in your office, and in your home. So in the acute phase, when you come to the clinic to me, I start to use a cream or like a steroid cream in the morning or in the evening or 2 times as well. And the rest of the day, I want to apply emollient all the time. After that, I remove the steroid gradually and enter with or increase the dose or the amount of or the time of application of the emollient. Withdraw the steroid and continue the emollient. Okay, number one, we had to divide the systemic treatments. What are the systemic treatments or the treatment by mouth we are taking? It's antihistamine, antibiotic if there is infection, systemic steroid if it's resistance and no response, and the last is biological treatment. And I'm not in charge here in this country to prescribe it. As the only doctors available to prescribe it in the governmental hospital. Okay, so I only will start with three systemic. The antihistamine, I can write it from the mild to moderate. I want to decrease the itching because, if he starts the itching, he will enter in a vicious circle. Itching will give a birth to a new itching like that. Number two, if there is infection like papules, like folliculitis, like impetigo, like staph, I had to prescribe the systemic antibiotic like dicloxacillin or ampicillin plus clavulanic acid. Number 3, the steroid or the systemic corticosteroid, I prescribe it in a low dose, not high dose, like 5 milligram per day, twice daily for 3 days or 4 days, and then I stop it. I prescribe the systemic steroid after I failed with the patient with the topical steroid, and I don't prefer to use the super potent steroid because most of the atopy hand and face, so I don't like to apply steroid on the face, because I saw many times here when the people come relax after applying the corticosteroid cream on their face, they had to repeat it without visiting the doctor or without asking the doctor. And so I saw it many times here, especially with special nationality. They are using steroid. I have a patient, she's using steroid now 9 years. So because of that, I change. I don't use a super potent steroid on the face. After I reach a moderate potent, I start with a systemic corticosteroid. Number 1 says a little, not too much side effect, which is sometimes burning sensation. I use it, but it's not too much use here because of 2 things. Number 1, there's only 2 or 3 companies in Saudi containing or using this cream. Number 2, it's expensive, not cheap. So I use it. But for me, if the patient use it, as I told him, give a good response. Okay, I first of all, I had to tell the patient that I will be liar if I told you that you will have a complete cure from atopic dermatitis. Sure, there is not a complete cure; it will come back. But only our rule, me and you, is to make the acute phase far away from each other. So instead of coming the acute phase of the atopic dermatitis every 3 weeks, we will make it every 5 weeks and every 10 weeks and every 2 months, like that. And I told him about the instructions, all the instructions, what increase atopic dermatitis, how can he control it, and how can he use it. So when I prescribe him the medicine, or he took the prescription from me, the first thing I tell him, don't repeat it until you come back to me. This is number 1. Number 2, when it come back to you and you cannot come to me, they start use emollient first, emollient, and the 3rd generation of the emollients first. If no response, come and check me necessarily, and don't use the creams alone. Number 1, about to keep the skin dry from the water or dry, and don't rub the skin after shower with the towel like that. No, but dry it gently. Number 2, to use the emollients. Number 3, to be away from the things which increase the atopic dermatitis for him. Number 4, if he can change his place to a humid area, if it's easy for him, it's okay. Number 5, sometimes I prescribe here in Riyadh the humidifiers that make the climate or the weather in the room which is more wet. After that, I start to use the emollients of the 3rd generation or 2nd generation, which contain laurestrin or laurestrin, the cell which build against the cells. I like Bioderma also components which build the skin again. This is the first thing. Number 2, he must wear cotton clothes, the polyester, which is not protect from the sun or which irritates the skin. It will increase the atopy. Number 4, and it's not too much about the food. Some of the food which make the skin, not the skin irritate, but when the irritation comes after the food or the food allergy, it will flare up the atopic dermatitis again. I don't know, but I think when the patient know about his disease, know about what is the side effects after that, even from the disease or even from the wrong use of the medicines, I think he knows that the best treatment strategy after the instruction, emollient, antihistamine, not sedative antihistamine, and change the lifestyle with the instruction, change the lifestyle, antihistamine, not sedative antihistamine, and emollient, and maybe mild hydrocortisone for 3 days.